Welcome back to Integrated Sports Medicine YouTube channel. Today we're going to answer some questions that you asked us on Instagram the past couple of weeks.
Let's get this party started. First question is going to be for Nicole Musina, physical therapist who's been practicing for a gazillion years. No, I'm just kidding. 19 years to be exact. So Nicole, in all your clinical experience, what advice or what information would you give to help patients who are being seen for issues with their sacroiliac joint, or better known as their SI joint?
The biggest advice is just go to your physical therapist and see where it's coming from, because it can be coming from your back, it could be actually your SI joint, it could be your hip, or it might even be your knee. So to figure out what the cause of that SI joint is going to be the biggest thing that helps you out to get rid of it.
So that's something you definitely recommend that these patients attend PT for?
Yes, highly recommend.
Okay.
Because a lot of times you just think it's your hip, you stretch it out, it's not getting better, and it's just going to drive you insane.
Anyone else on our panel have any more input for that question? Or do you guys think Nicole nailed it?
She nailed it.
Okay. All right, let's move on to the next question, which is going to kind of feed off of the question we asked Nicole. So this question is going to be for our newest staff member, for Dr. Katie Wolfel, who's a recent graduate from Shenandoah University's DPT program. So Katie, with all of your experience from school and recent clinical education, if a patient asked you, how do I fix my SI joints that always flares up so that I can lift better, meaning in the gym, I believe, what advice and what would you do with that patient?
So going off of what Nicole said, definitely finding the origin of it. It could be coming from a multitude of areas in your body. And if it's only flaring up when you're lifting, you can definitely come into PT, and in your eval we can look at your form and look at how much you're lifting, frequency, dosage, all that stuff, and kind of get a game plan going to getting you stronger and lifting better.
Okay, so I'm going to piggyback off that question. So we have another question for Katie as well. And this is a pretty common one we see in the clinic, and it was one that came up on the Instagram post, obviously. It says, how do you prevent sciatic pain from coming back?
So it's definitely a common question we get. We get some frequent flyers for low back and sciatic pain, and I think the easiest answer for us would be keep up with your home exercise program that we give you. Definitely keeping up with all of your targeted strengthening and mobility, as well as form, whatever you may be doing. If your hobbies may be lifting, swimming, etc., kind of finding the source and pattern of your symptoms as well can help us kind of target your rehab process.
Okay. Any of you have any other input to those two clinical questions?
I think strengthening was key.
Yeah.
Okay.
Really continuing that strengthening of the core and trunk and stability.
For sure, I'd agree with that. Okay, well, let's jump around to a different body part for this next question. Well, maybe not. Maybe we'll keep it kind of on the similar page. So let's defer this to Dr. Laura Fawcett, who comes to us today with 11 years of clinical experience. Okay, and by the way, she's been integrated the entire time, just saying. Laura happens to be our pretty much on-site running specialist. So, question came in, shin splints. How do you get rid of and keep them from coming back?
Shin splints could be complicated or straightforward, but mostly we're going to want to look at your overall mobility and your ankles and your knees to make sure things are moving the way they're supposed to, but also look at your footwear and see if you're wearing the right type of shoe for your desired activity.
Okay. Anyone else have any input to that question? Okay, so let's go off of that one. So piggybacking on the shin splints question, we'll go back to Laura for this one. What are some exercises you'd recommend for someone suffering from a diagnosis of plantar fasciitis?
Plantar fasciitis can definitely be a challenging diagnosis to work with, and it's often chronic and can be long-standing. Ideally, you want to make sure you have good motion through your ankles and your foot, but for some daily maintenance exercises, freeze a water bottle, roll your foot on that, stretch it first thing in the morning to get those tissues moving, but also you want to make sure you're strengthening that area so that your tissue is nice and strong to tolerate the activity that you want to do throughout your day without causing any increased pain or inflammation.
Anyone else have input to that? So far what I'm seeing with most of these questions is it looks like multiple body part focus is key for fixing a lot of these things versus just focusing on the symptom, but finding the source of that symptom. All right, let's move on to the shoulder, because we do have a lot of shoulder patients in the clinic. So we're going to direct this one over to Corey Lawson, PTA, who's been with Integrated for 8 years.
Just 8. Just past
Yeah,
8.
so she just celebrated her 8-year anniversary with us. So Corey, who has had some shoulder issues herself in the past, have you successfully treated anyone with a slat tear who did not have surgery?
Yes, definitely. I definitely think it's key to try conservative treatment even prior to jumping to surgical options. We've definitely been able to treat them without ever having to have surgery. The biggest thing we first do after the initial injury is to decrease the inflammation and pain. So we're going to use modalities and soft tissue work, some gentle stretching in areas that are tight to get the symptoms down. And then once we've gotten there, we really want to build up the strength and stability of the shoulder, not forgetting the shoulder blade muscles in the back of your shoulder, which are commonly weak and can often lead to why you got the tear in the first place. So it's something that we need to correct and create stability throughout the whole shoulder, and posture, and try to get you back to being able to lift and do your daily activities pain-free and get the stability there.
Okay, so this question, we're gonna bring it back to Nicole, is what can I do to lessen my neck stiffness from sitting at the computer all day? Especially now that people are working from home and kids are doing virtual learning, we're seeing more of this come in the door.
Don't sit at your computer all day. Set a timer, get up and move around. Even if you sit there and just do a couple neck stretches here and there, down, stretch out the front of your neck. That little series every half an hour is going to make you feel much better at the end of the day.
Okay, anyone else have anything they want to add to that? Any more
Sometimes
tricks?
you can get like some lumbar support, which will actually help the neck. I think sometimes we get in that slouch position, and that will bring the shoulders forward. So if you support your back, that can help your shoulders too.
And also make sure monitors in front of you, not off to the side. And also make sure your keyboard and your mouse is as close to your trunk as possible so you don't aggravate your shoulders.
Okay, so now that we've talked about sitting all day, let's talk about sleeping. So, we're going to give Laura this question, which is probably something that every single one of us gets asked almost every day in the clinic, is what's the best position I can sleep in?
Definitely a very common question, and the answer is it depends. And typically you're going to find a position that's comfortable for you, and that's going to be different for everyone and every person based on their particular body type, their sleeping habits, and things like that. Now, if you have a particular area that's kind of, chronic stiffness in your back or your hip, we can help identify positions that will maybe take some pressure off that area so that you can sleep more restfully, and give you different strategies to use so that you can set yourself up in a comfortable position. But typically you're going to move around at night even if you don't realize it, but maybe trying to help you find a comfortable position to fall asleep in, and then maybe some stretches or exercises first thing in the morning to get you moving better if you always chronically wake up stiff.
Okay.
If there's any particular exercise you want demonstrated or have a very specific question about physical therapy, write it down in the comment section below. We will get back to you. And as always, like, comment, and subscribe.